Welcome to Kingsburg Medical, where we specialize in the HCG diet in a very safe yet effective way. The HCG diet consists of staying under 500 calories a day while injecting 250 units of HCG daily along with 500 units of B12 daily. The B12 is a very important part of this protocol. With such a low-calorie diet, you need the B12 to support your brain function, immune system, and energy levels. To explain how the HCG diet works in a fairly simple way, we can take a look at women that are pregnant in third world countries that are obviously malnourished. Yet when they have their babies, the baby comes out healthy. The reason being is that baby gets everything that it needs from the mother's stored fats, calories, carbohydrates through the mother's placenta. The HCG diet works in a very similar way. It tricks your body into feeding off of its stored fats, calories, and carbohydrates. Along with these medicines, you'll have to follow a very strict diet. The diet consists of staying under 500 calories a day. We will provide all HCG diet patients with a mandatory reading manual. This manual will explain the diet from start to finish to a T. By following this manual perfectly, women can expect to lose from a half a pound up to a pound a day, and men a pound to 2 a day. We recommend incorporating a low aerobic activity or exercise regimen into your HCG diet. This will only help you lose an even more sufficient amount of weight during your protocol. Now, Gary McCord, who's currently on the HCG diet, is going to show you how to safely and properly do your injections of HCG and B12.
Hi, I'm Gary. I'm going to walk you through the steps of preparing the HCG and the injections for your therapy. The first thing that we're going to do is to prepare the HCG for the injection. The first thing that you want to do is to take the bacteriostatic water, pop the top off of that, and then on the HCG, as you can see in the middle, it's got the pull tab. You just want to pull up on that, pull it off, and that'll show you the rubber stopper. Next, you're going to take your 10 ml syringe that was provided for you, and you're going to take the needle tip and turn the needle tip clockwise and turn it onto the syringe. Next, you're going to take the bacteriostatic water, hold the bottle upside down, and then pull the sheath to reveal the needle. What you're going to do, since we're adding 11 mLs of water, we're going to pull the plunger all the way back, filling it up with 10 mLs of air. And we're going to inject the needle and compress that 10 mLs of air into the bottle of bacteriostatic water. And then you're simply just going to pull out 10 mLs of the bacteriostatic water. Next, you're going to take the HCG vial, and when you inject the needle, you want to do it at an angle so that the water runs down the wall of the vial and not directly on the medication. You're then going to have to add 1 more ml of the bacteriostatic water so that you have the full 11 mLs of water. Again, we'll pull the plunger back just past the 1, inject it into the bacteriostatic water, inject it in and draw out the 1 ml solution. Be sure that when you're measuring it, the top of the plunger is the mark that you're looking for. And then just simply add that into the HCG vial. To mix the solution, you never want to shake it. You simply place the vial in between your hands, rub your hands back and forth for about 20 to 30 seconds, and you'll see that the solution will start to clear up and look like water. Once the solution is prepared, you're going to take your insulin syringe, remove the end cap, and then remove the sheath, revealing the needle. And then we're simply going to pull back your dosage, which would be 250 units, so you would pull the plunger back to the 25 mark. And then again, put the needle into the vial, press it in, and then slowly draw out. 25 units of the HCG. And then recap the syringe, the needle, and put that off to the side until you're ready to do the injection. The next medication that we'll prepare is going to be the B12. The B12 is going to be the same procedure as the HCG. It has the plug in the center. You're simply going to pull that up and reveal the rubber stopper. And again, you're going to use the insulin syringe, but this time we're going to use a full syringe. So take the cap off. You're going to pull the plunger all the way back to just past the 100 unit mark. Inject the needle into the vial, compress that air, and then draw out a full syringe of the B12. And again, replace the sheath on the needle and you place it to the side for injection. For your B12 injection, you're going to inject into the shoulder region. So we want to take the alcohol swab, clean the shoulder, and you're simply going to remove the cap, exposing the needle, and then you're simply going to go right off center, inject it, and just compress it. Press it all the way in, and then pull out. When you pull it out, there shouldn't be any blood. If there is, you're just going to wipe it with a cotton ball alcohol swab and put a Band-Aid on. To prepare for your HCG injection, you simply want to take an alcohol swab and you're going to clean the area. You're going to take the HCG in the stomach 3 inches to the left or 3 inches to the right of the belly button. Pinch, and then just take the injection sideways here. And that's it.
If you have any questions that haven't been answered throughout this video, remember you can call at any time. One of our professional, highly trained medical advisors will be here to assist you. We'd like to thank you for choosing Kingsburg Medical, where it's our goal to improve the quality of your life. But remember, we all have to age, but we don't have to feel.